Good evening. Welcome to Live United, Living United, where we hear about all the wonderful programs here in the Monadnock region that make a difference in the lives of our citizens. Today, I have a very unique opportunity to interview Kate Dexter. Kate comes to us from Home Healthcare Hospice Community Services and is involved with the hospice program. And what makes this truly unique, I believe, is that hospice is a very interesting program that's probably hard for many of us to talk about. So I want to welcome you, Kate,
Thank you.
and thank you for being here. Hospice is one of those things that we don't necessarily always want to think about.
Exactly.
Because it's usually a very difficult time in our lives, in our families' lives, or somebody we love. May not be a family member, but it's somebody we love.
Right.
So I want to really give you an opportunity to share with people when do you bring in hospice? What do we need to understand about hospice?
Well, I think first a little history of what hospice is and what we've been doing in this community. HCS has been providing hospice services since the 1980s when the Medicare hospice benefit was first created because there was a need. Medicare acknowledged that there was a need for patients who do have life-limiting illnesses, that they have particular needs that the home care benefit didn't cover. So hospice was created back then. We've been the local nonprofit hospice in the area. We are a United Way agency. And we've been providing care to people who have life-limiting illnesses, regardless of age or what the diagnosis is. And it's a nice complementary service to have. When to get hospice involved is a very difficult thing, and it's a very difficult conversation. We typically get our referrals from people's physicians when they've recognized that there's no longer a benefit from doing more aggressive therapies, from more hospitalizations, for more antibiotics or aggressive antibiotics. Typically, families can also be the ones, though, that obviously notice that there's been a decline. And sometimes it can be just an overall decline in how they're functioning, how they're doing their everyday tasks. It's harder for them to get out of bed. It's harder for them to bathe. It's harder for them to eat. Maybe they're losing weight. Maybe they're going to the hospital more and more. And it just can be a cycle that just gets ongoing and ongoing. And I think it's up to families to really ask the questions about what are our options here. If he gets another pneumonia, is it going to benefit him to have another hospital stay? And the other piece that ties into that is recognizing what the person's goals are and what their wishes are. Oftentimes it will be the person themselves that says, I don't want to keep doing this. I don't want to keep going to the ER. I don't want to keep going to the hospital, and I just want to stay home.
And is hospice always cared in the home?
Mostly in the home. Most of our patients that we serve are in the home, but we do have patients who live in assisted living facilities and nursing homes, and hospice is a wonderful complement to the care that they're already getting in these facilities.
Do you have any advice for family on how to initiate, how to have this conversation?
I think the best advice right now is to have these conversations before you need them, which is easier said than done because it's a difficult conversation to have with your family about what does my end of life look like. And I think if there's a big movement right now for advanced care planning, I think that process would make having this conversation much smoother because you're already designating who you would want to make your decisions in case you're unable to do so. You're designating what you want as far as life-sustaining treatments, and that can be a natural lead into, okay, so if we're told that these things are not going to be helpful, where do you want to be for your final days? Do you want to be home? Do you want to be in a facility? And who would you want caring for you? Oftentimes, hospice relies on the patient's families to be the caregivers. So our goal is that we want to have patients die with their symptoms controlled, in good pain control, and we want their families to feel supported emotionally and spiritually as well, so that it can be just a good process for everybody in the final days. And I think, too, we talk about hospice being end of life, but what we really focus on is the living. We focus on good quality of life. So from emotionally, physically, mentally, and spiritually.
And I think the challenge probably for many families, because we went through this, my very own family, and my dad had Parkinson's, and as he was deteriorating, we kept struggling with, is this the time we call in hospice?
Yes.
Is he truly at that place? What's he telling us? There was a couple of times when he was like, yep, I think, this is it. And then he hung on a little bit longer.
Yes. Yes.
And what was really beautiful about hospice, though, at least for our family, was that they were with us through the whole thing. So as you're talking about, it's about the living portion of things. I think it's really important for people to hear that, because that was our experience.
Right.
That it wasn't the last week or 2 weeks of his life.
Right.
In his case, I got a phone call. They said, he may not make it through the night. He survived the night. He lived 4 more months.
Yes.
So I think we don't know when.
Right, exactly. And that's something, too, that it's harder to predict with the chronic diseases like Parkinson's or dementia or heart failure or lung disease, because those have so many peaks and valleys, and how do you know when somebody's going to rally? What's nice about the hospice benefit is that we look at, to qualify for hospice, your physician has to feel like, okay, in their best guess, you could have a prognosis of 6 months or less. But we're not bound to that. So we do have patients who we extend longer than 6 months because we feel like they are declining. It's not quickly, but they are making a gradual decline. And it's, there is no crystal ball for predicting this. So again, we also find that when people get hospice involved sooner than later, they just have a better experience. They get to get some of the rewards of the benefit.
And I know our experience was that some of that benefit is the companionship. And not just for my dad in our case, but for my mom, who was really struggling with knowing that she was going to lose this person she'd been married to for 45 years and loved dearly.
Right.
And so I think that whole support system that is built around hospice is important for us to think and prepare for ahead of time, because you're all living.
Exactly.
And you're living that experience together.
Yes, and that's a good point. Hospice, we see the patient and their families as one unit. So the plan of care is really built on what are the patient and family goals and how can we best support everybody. Hospice brings in a team of people. We keep working with the patient's primary care physician, because usually they've been involved for so long. So they still direct the plan of care, but we also have a hospice medical director who is board certified in hospice and palliative medicine, so she's a great resource for symptom management or even doing a home visit if needed. We have a team of registered nurse nurses who are trained in symptom management. They're certified in hospice and palliative care. And we have social workers who can do the emotional support. Again, sometimes it's not the patient that needs it, it's the family member. And occasionally they'll go to the home and they hardly meet with the patient because they don't feel they need it, but they're meeting with the daughters or the sons or the grandchildren. We also have a spiritual counselor, a chaplain, and they do the same thing with supporting the patient and family. And furthermore, we have volunteers. The volunteers can provide respite for the families so that they're able to go out and do errands and know that somebody is there with their loved one and they don't have to worry. They can do the companionship, they can do the light housekeeping, anything that's helpful for the patient and family. We really tailor the plan to what their specific need is. But going back to that, preparing to lose somebody that, like your dad, where your parents were together for 45 years, is a lot. And one of the beauties of the hospice program is that we have bereavement support, and that goes for a year after the patient has passed. So there's that contact, there's outreach and individual support, group support, and we do a nice memorial service too afterwards for people, a group memorial service to honor all the patients we've cared for.
And we're going to talk a little bit about that and actually see some pictures here in a few minutes. But before we do that, you mentioned two things that I really want to ask you a little bit more about. One being the volunteers.
Yes.
Because volunteers, I believe me, I remember how important they were, because they came in and did give my mom that respite piece, because, all of us children lived, I was the closest and I was 2 hours away.
Yes.
But the others were living in, Virginia and Rhode Island and Georgia at the time. So not easily able to get there and provide that respite service. So the volunteers are critical. Does it require special training?
Yes, so our volunteers have to go through an 18-hour training, and we have 3 trainings a year, typically 2 in the Keene Fall Mountain area a year, and then 1 in the Peterborough area. So Lorraine Bishop is our volunteer coordinator, and anybody who's interested in doing the training could contact her and she can talk to them about it. It is Tuesday afternoons. It's 7 or 8 weeks, so it's a good block of time. And it's just a wonderful, wonderful training to make sure that people are really prepared to being in the presence of somebody who's end of life, because there are unique needs.
And you also mentioned the Medicare end of things. What if somebody doesn't have that eligibility?
Right. So Medicare is our biggest payer source. But if people have private insurances or Medicaid, they also have a hospice benefit that is modeled after the Medicare plan. However, we are a United Way agency, we're nonprofit, we do not turn anybody away. So we always find a way to make sure that people in the community get the care that they need.
And do you serve people of all ages? Because
Yes.
I know people experience this with children all the way through
Yes,
senior
all
years.
all ages. So, and again, it's it's something that we do see children occasionally. They're not often though. Oftentimes they stay connected with the hospitals, but certainly we have had several children on, and people from all ages with all different unique circumstances and family dynamics and different social situations that we work with. And again, it's accepting people for what their beliefs are, what their goals are, and honoring that.
So let's talk a little bit about that and pull up some pictures here, because there's some very unique aspects to the hospice care that goes on. And one of those is you have a Pet Peace of Mind program, and they are our family.
Yes, and that's a really unique program. I think this is the butterfly
This is the
event.
butterfly release, so we can start
about
there.
that.
You mentioned this actually
Yes.
a little bit ago, that you do a service to remember all those
Right.
who've been part of a hospice.
So we have an annual butterfly release, and many people may not know, but on 312 Marlborough Street, where our office is, we have next to us a butterfly park. And that is a park that people can go and remember and reflect on their loved ones. We have memorial stones that people sometimes purchase so that they can pay tribute to their family members. But every June, what we do is a butterfly release, and that again is to honor the patients that we've served on hospice, or patients that family members that have been lost, and also veterans in the community. And I shouldn't say it's just patients that we've served on hospice, because we do include community members such as the local facilities, the area nursing homes and assisted livings to come as well. And they'll bring residents. What's really nice is that our chaplain has some inspirational words, and then we have music. We do a pinning to honor our veterans and take a moment to express our gratitude for their service. And then afterwards, we do some refreshments. And families come, they bring the kids, the grandkids, and you get to release a butterfly, and it's just a lot of fun.
And I believe that event is coming up. Is that correct?
It is. I want to say it's June 23rd, but I'd have defer to the HCS
So
website.
I would encourage people to reach out and call HCS
Yes,
to
yes.
find out when that is, and we'll talk more about the phone number and things.
Yes.
But I do want to highlight the other aspects to hospice that you offer, because you mentioned the vets piece,
Yes.
but I want to pull up some other pictures
Sure.
we have here, because you do the pet
Peace of Mind. It's been a very popular
here we
program.
go with
This is
that.
Lorraine Bishop. Lorraine Bishop is our volunteer coordinator, and she also runs the Pet Peace of Mind program, which does have volunteer participation in it. Pet Peace of Mind acknowledges that not only are people members of the family, but their pets are members. And for some people, we've learned that pets can be the most important members of the family. And this is our poster child. This is a dog named Gus, and Gus was one of our dogs that we had for Pet Peace of Mind. We had provided him with a volunteer to run and get him his food. We even had a volunteer that could take him for a walk occasionally because his owner was too ill to do so. And then what we helped with was the transition plan. So what happens when Gus's owner passes away? And we got them connected with resources and found a boxer rescue. And as you can see, he found a new family, and they had that peace of mind knowing that he was in good hands. What was really nice in that situation is that the new owners sent a letter to the boxer rescue about what Gus's life was like in his new family. And that letter got sent to us, and we got to read it to him before he died. And he was not able to respond verbally, but we could see a tear coming down, knowing he heard us, and he knew his dog was in good hands.
And that is, as you said, peace of mind
Yes.
for many people, because
Yes.
they are family, and for many people, they're like their children.
Oh, yes.
So it was interesting. I was watching all the posts about Mother's Day, and Mother's Day was acknowledging that a lot of moms are moms to their pets.
For
So
children, yeah.
really,
Yeah.
really important.
It is.
Now, one of the other pieces you have, and I believe we have pictures of this, is the We Honor Vets.
Yes. HCS is a We Honor Veterans agency. What that means is that we take the time to acknowledge our patients' service if they're veterans. If this is at the butterfly release, so we do a special section for the veterans. But part of this program provides training to our hospice staff about the unique needs that that veterans have at end of life, maybe a little bit of background on the different wars they might have served in and what those unique needs are. And we do ceremonies to express our gratitude. So we do pinning ceremonies. We have a volunteer who is a retired colonel, and she does a very nice reading and does the pinning to thank them for their service. Oftentimes we've found that this is more important to the family sometimes than it is to the patient, or vice versa, but it's just a nice way to have everybody together, acknowledge the service. They get a little certificate and a pin, and it's been a real popular program. We also had one of our social workers who identified that a gentleman was a veteran, I'm sorry. She worked with the veterans group to make a trip possible for him to go see the war memorial. So that was just that was, the biggest thing that we've done, but certainly is a popular program.
So, part of this show is about how people can give, which they
Yes.
can give, both of, financially, they can support hospice,
Yes.
certainly, because a lot of it is run through insurance and
Exactly.
supportive people out there. But time, and really volunteering your time.
We could not do the work we do without our volunteers. They are one of the most important members on our team. They're a real integral part in the plan of care. And there are different ways to volunteer. So it doesn't have to be, again, like I said, it doesn't have to be particularly at the patient's bedside. Sometimes it's they need help running an errand, or they need help with housekeeping. There can be ways to give your time that's just so priceless to the families. And we do have volunteer recognition coming up with HCS too. So in May, we'll be honoring our hospice volunteers. So yeah, it's...
And, the other aspect of the show is about being an advocate. And I really want to go back to that piece of thinking and planning ahead for this, because that really does provide people the opportunity to be an advocate for that loved one.
Right.
Perhaps when they can't be their own advocate at
Yes.
that point.
Right.
And, I do want to highlight with my mom, although she didn't become a hospice volunteer, she learned so much through her experience working with hospice with my dad. Then when it came to her time for her end of life, she had all of those skills
Yeah.
herself. It was very interesting for us as a family to see her be so at peace herself.
Right. And I think that's something that people don't understand unless you've been through hospice, is the ways that it can help, and that it is an option for people if you do want to stay home, or and some people's homes is the facilities too. If you do want to just stay where you are and be cared for in the surroundings that it's people need to know that that's always an option, and that we are able to help. One of the things that I wanted to point out is that if there's any questions, that people aren't sure if they're ready for hospice, or if their family member is ready for hospice, you can always call HCS and learn about hospice services, and we're able to talk to anybody anytime.
So can I just chime in here, because a lot of people won't know what HCS is.
Oh, yes.
So Home Healthcare Hospice Services, and we'll have Kay here in a minute, actually share the website and the phone number.
Yes.
But you can also reach out through 211. And if you call 211 and just say you're looking for hospice services, they will automatically direct you to what's called HCS for all of those in
Yeah.
the field. So tell us what the phone number and website
It's
are, Kate.
352-2253, and we are at hcsservices.org. The other thing I want people to know is that the first Wednesday of every month from 3 to 5, we have walk-in Wednesdays, and that's where people can come and walk into the HCS office, and they can meet with one of our staff members and find out about different programs. Oftentimes, it's listening to what the needs are. You may walk in thinking, oh, I'm ready, or my loved one's ready for hospice, but on further discussion, we may find, boy, they might benefit more from the Castle Center, which is the adult day center, or customized care, which is private duty, or maybe the VNA. So that's the beauty of HCS, is that sometimes people occasionally will get referred for hospice, and after we evaluate them and discuss the case with their physician, we may find it's not quite time. But we do have other programs in the agency, and we've got the home health program, we have a palliative care program, and the private duty and the adult day center.
And the VNA that Kate mentioned is the Visiting Nurses Association.
Yes.
You are located on Marlborough Street in
312.
Keene, New Hampshire.
312 Marlborough Street.
Correct. So if you want to walk in on a Wednesday and find out more about the services that are available to you, you can do that on Marlborough Street any Wednesday?
The first Wednesday of the month.
First Wednesday
And
of the
also you can walk into our 2 other office locations. We have one in Peterborough on Main Street, and we also have one in Charlestown. So
Very nice. And are there specific hours that
3 to
people can walk?
5. 3
Okay,
to 5,
so 3
first
to 5.
Wednesday of the month.
All right. One of the things we may want to do is make sure that that gets posted if
Yes,
it's not already
yes.
on
Should be
our
on our
local
website.
TV station.
Okay.
Kate, any last thoughts? We have about a minute left here in the show, and any last thoughts you want to share with folks?
I think I would like people to know that hospice is an option. Again, we focus on living and we focus on good quality of life. So if you're dealing with a life-limiting illness, and you're wondering if it's an option, to please contact us or your physician, and we're happy to talk that through.
So, Kate, thank you for joining
Thank
us
you.
and on such an important topic, because we all face it at some point in our
Yes.
lives. Audience, I want to thank you for joining us tonight. Remember to give, to volunteer, to advocate. We have great things like home health care, hospice here in our community, making a difference throughout the region, and especially our hospice program. Thanks for joining us.
Thank you.